you've called for people to leave politics out of this. Joe Biden said the World Health Organization offered testing kits that they had available to the United States and to give it to us now. We refused it. We didn't want to buy them. PolitiFact says the WHO never made that offer. Can you tell us?
Well, that's what I heard, and I'm going to let Tony answer that question, or whoever's best at answering that. But I do have to say, when you talk about politics, I watched the debate. Not too exciting, but what they said about me, and we've done a great job. When you talk about not being bipartisan, what they said about me, and if you look at swine flu, the whole thing, and I guess it was 2009, and what they did and the mistakes they've made, they were terrible. They were horrific mistakes. 17,000 people died. And I'll be honest, they shouldn't be criticizing because we've done a fantastic job. The only thing we haven't done well is to get good press. We've done a fantastic job, but it hasn't been appreciated. Even the closing down of the borders, which had never been done, and not only did we close them, but we closed them early. The press doesn't like writing about it. So we've done a poor job on press relationships, and I guess I don't know who to blame for that. I don't know. Maybe I can blame ourselves for that. I will blame ourselves, but I think we've done a great job. I think we've done a poor job in terms of press relationship. But let me have somebody answer your question.
Yeah. So I tried to cover this in the answer when I talked about quality of kits, and our quality analysis runs through the FDA. So all of these platforms, we have asked people to submit, and we've asked states to quality control. So, I mean, anybody could submit their test to us. We don't buy tests that haven't been quality controlled and they show us the data. Either show us the data up front or show us the data after they've been running them. Because quality testing for our American people is paramount to us. It doesn't help to put out a test where 50% or 47% are false positives. Imagine what that would mean to the American people. Imagine their level of concern now and telling people that they're false positive. We take this same approach to HIV. Imagine telling someone they were positive to HIV and they weren't. So that is our bottom line, the customer, the American people first. And so any of these groups can submit their testing kits through our regulatory processes. But without that and without a plan, we are not going to accept tests that have not been studied by us.
Good answer. It's a good answer. Would you have something on that?
I'm just going to emphasize a little bit more on that. When I became involved in the testing world, I called as senior officials at the WHO as I could find to understand what the situation was. And as far as I can tell from sources that should know, no one ever offered a test that we refused.
That's what I heard too.
This is a research grade test, right? Research grade test that was never submitted, not approved, not submitted to the FDA. That was supplied in tens of thousands of quantities to 100 countries in the world. Okay, so I think there's a lot that people are saying about this that's just based on rumor and myth. Nothing was offered that we refused. It was a research test that was not approved. And again, there was a small number that we have greatly surpassed in a very short period of time.
So number one, nothing was offered. Number two, it was a bad test. Otherwise, it was wonderful. Listen, thank you very much. No, he made a mistake. I assume that he'll apologize. He made a mistake. Thank you all very much. Thank you. We'll be back. Thank you all.